Welcome back to the EOE Resource Podcast, the show where we unpack the science, share real stories, and help you navigate life with eosinophilic esophagitis. I'm Andrei, an EOE patient, and your host on this journey. I've lived through the questions, the trial and error treatments, and the relief that finally comes when things start to click.
And I'm Sarah, here again to help break down the medical side of EOE into information that's clear, current, and actually useful. Whether you're newly diagnosed or still trying to find your best treatment plan, today's episode is packed with what you need to know about medical therapy.
And this particular deep dive, it's really tailored just for you. We're pulling insights from, the latest research, expert guidelines, and real patient experiences.
Yeah, we're here to kind of distill those key nuggets of knowledge about EOE, help you feel more informed, more empowered.
Exactly. And just a quick note, the voices you're hearing, they're powered by AI technology.
Yeah,
It lets us bring you the freshest information and tools we can.
So today, our focus is really squarely on medical treatments for EOE. We'll cover everything from, well, the surprising role of PPIs to the targeted action of topical steroids.
Right.
We'll touch on biologics briefly, but just so you know, Dupilumab, that specific one, it's so important it's getting its own dedicated deep dive later. So definitely stay tuned for that.
Yeah, looking forward to that one.
Yeah.
But starting here, when I was first diagnosed, my immediate thought was, okay, if I'm changing my diet, do I really need medication too? I think that's a super common question.
Oh, absolutely. It's probably one of the first things people grapple with. And it's crucial to understand EOE isn't just like simple heartburn. It's a chronic condition driven by the immune system.
Right.
Think of it like this ongoing immune response, a battle happening right there in your esophagus. And without treatment, that inflammation, it can cause long-term damage. Things like scarring, narrowing, what doctors call strictures.
Strictures, yeah.
And the really key thing here is, even if your symptoms feel kind of mild, or maybe they're even, quiet, the disease can still be progressing silently underneath. It can lead to those structural changes you might not feel right away.
That is exactly what happened with me. I mean, I just dismissed things like food getting stuck sometimes or always needing water to swallow. I thought, oh, that's just how I eat. Didn't realize it was like actual signs of damage starting.
Exactly. And that's why the goals of treatment go beyond just, feeling better today. We're really aiming for 4 main things.
Okay.
First, symptom relief, definitely. Second, something called histologic remission. That means getting those eosinophil counts way down in the tissue itself.
Right, the actual cells.
Yes. Third, preventing those long-term problems, the strictures and scarring. And fourth, just improving your overall quality of life. And, often medical therapy is the most direct and, frankly, effective way to hit all those goals.
Okay, so let's dive into the meds, starting with PPIs, proton pump inhibitors. Most people know them for acid reflux, right? So it's easy to just think that's all they do.
Yeah, and you're definitely not alone in thinking that. Originally, PPIs were mainly used to rule out GERD, acid reflux, before doctors would even confirm an EOE diagnosis.
Right, like a test.
Exactly. But what's really interesting is that research has shown they actually have their own significant anti-inflammatory effects. So they're relevant as a direct treatment for EOE itself, not just a way to exclude GERD.
So how does that work then? How do they fight inflammation beyond just cutting down stomach acid?
Yeah.
Especially for EOE.
Well, PPIs like omeprazole, esomeprazole, lansoprazole, they do a lot more than just suppress acid. Think of your esophageal lining like a protective wall.
Okay.
Research shows PPIs can actually improve that wall's function, make it less leaky, essentially strengthening the barrier. And maybe even more importantly, they can inhibit the production of a key chemical signal called Eotaxin-3.
Eotaxin-3, right?
Yeah, you can think of Eotaxin-3 like a chemical flare, basically yelling, "Come here!" to those eosinophils, attracting them to your esophagus. So by reducing that flare, PPIs help quiet down the inflammation.
Okay.
And there's also some evidence they might indirectly impact the broader inflammatory environment, specifically by lowering inflammation driven by another immune signal, IL-13.
So, wait, if I'm getting this right, the link to things like IL-13 is kind of indirect. They don't shut off the main alarm, but they mess with the signal telling the eosinophils where to go.
That's a great way to put it. Precisely. PPIs don't directly slash the levels of the big immune signals like IL-4, IL-5, or IL-13 itself, but they are pretty good at reducing the downstream effects of those signals, especially how IL-13 stimulates that Eotaxin-3 recruitment call we talked about.
Gotcha.
And we've seen this in lab studies, using actual human esophageal cells, and it's been backed up by clinical studies in patients whose EOE responds well to PPIs. So, yeah, they don't tackle the whole immune orchestra, but they effectively mute a really critical instrument that brings the eosinophils to the scene. And in terms of how well they work, studies show somewhere between 35 to 60% of patients can achieve histologic remission. Remember, that's getting down to 15 or fewer eosinophils per high-power field under the microscope.
Okay, 35 to 60%.
Yeah, and interestingly, we actually see higher success rates in kids, sometimes up to 80%. In adults, it's typically more in the 30 to 50% range. And usually you'd expect to see a response within about 8 to 12 weeks.
Huh. I've definitely heard patients say, yeah, I felt way better after a couple of months on a PPI, but then they have a scope and the eosinophils are still there. What's going on there?
That's such a critical observation, and it really highlights why we always emphasize checking things objectively. Feeling better is fantastic. It's goal number one, right? But symptom relief and actual healing deep down in the tissue, they don't always match up perfectly. So we always recommend a repeat endoscopy with biopsies to check the histology objectively.
Even if you feel okay.
Exactly. It makes sure that underlying inflammation is truly under control, even if the symptoms have quieted down. It's a really key part of managing EOE effectively long term.
Okay, that makes sense. So moving on, topical steroids were the next step for me.
Yeah.
And I remember being really surprised, actually. I always associated steroids, especially inhalers, with asthma. So swallowing one from my esophagus felt weird.
That surprise is super common, but the approach, it's actually quite clever. For EOE, these topical corticosteroids are specifically meant to be swallowed. That lets them directly coat the esophagus where the inflammation is. The two main types we use are Budesonide, which you can mix into a thick slurry or sometimes get as an oral dissolving tablet, an ODT.
The slurry, I remember that.
Yeah. And the other is Fluticasone, which comes in a metered dose inhaler, like an asthma inhaler, and this is key, you swallow it, you don't inhale it into your lungs.
So what's the science there? How do these swallowed steroids actually calm things down in the esophagus?
Well, these steroids work by binding to specific receptors, kind of glucocorticoid receptors, which are on both the immune cells and the epithelial cells lining your esophagus.
Okay.
Think of it like they're flipping a switch on those cells. That signal helps reduce the recruitment and the activation of the eosinophils. It also tells the cells to suppress the genes that promote inflammation. And it actively encourages the esophagus lining to heal itself and reduces the tendency towards forming scar tissue or fibrosis. So basically, they deliver strong anti-inflammatory action right where it's needed, with minimal absorption into the rest of the body, and they work pretty well. Budesonide, for example, studies have shown it induces remission in about 60 to 80% of both adults and kids. Fluticasone, when you use it correctly, shows similar effectiveness.
Okay, you said when used correctly. That sounds important. How you take them really matters, doesn't it? I know I messed that up at first.
Oh, you are absolutely right. The administration method is vital for these to work properly. So, for the Budesonide slurry, you mix the dose with a thickener, like sucralose or maybe applesauce. The key is swallowing it slowly, trying to really coat the esophagus on the way down. And then, the golden rule, wait 30 minutes. No eating, no drinking for 30 minutes.
30 minutes, got it.
And for Fluticasone, from the inhaler, you spray it into your mouth without a spacer device, and then you just swallow it down. Again, don't inhale it. And same rule applies. No eating, drinking, or even rinsing your mouth for a full 30 minutes.
Okay.
That waiting period gives the medicine crucial time to sit there and act directly on the esophageal tissue before anything else comes along.
I definitely made that mistake early on. I'd take a sip of water right after or rinse my mouth thinking it might help. I don't know why. Now I actually set a timer on my phone for the full 30. It's just part of the routine. Non-negotiable.
That's a fantastic practical tip because rinsing too soon, it basically just washes the steroid off your esophagus before it's had a real chance to work.
Okay.
And then after the 30 minutes are up, then rinsing your mouth or brushing your teeth is actually a good idea. It helps get rid of any leftover steroid lingering in your mouth, and that lowers the risk of getting oral thrush, which is, one of the more common side effects, usually mild, but still something to avoid.
Okay. Speaking of side effects, are there any long-term worries with using these topical steroids?
Generally speaking, they're considered quite safe for long-term use, mainly because they act locally in the esophagus with very little getting absorbed systemically.
That's good.
But we do monitor for potential side effects. Oral or esophageal candidiasis, that's the thrust we mentioned, can happen in maybe 10 to 15% of patients. With really long-term use or very high doses, there's a small theoretical risk of adrenal suppression, so doctors keep an eye on that. Voice hoarseness can sometimes happen too. And for kids, while systemic absorption is minimal, growth monitoring is usually recommended just to be safe.
Okay. So what if someone tries PPIs, they try the swallowed steroids, and their EOE just isn't responding well enough? What's next? Where do you go from there?
Yeah, that happens. When patients don't respond well to those first-line therapies, we call their EOE refractory, and that's when we need to explore other paths.
Okay.
Biologics like Dupilumab are a really major development here. And like we said, we're going to dedicate a whole deep dive to those soon.
Right.
Sometimes combining treatments can work using both a PPI and a steroid together. Then there are some older or maybe more experimental options, things like cromolyn sodium, that's a mast cell stabilizer, but results are usually modest, or montelukast, which affects leukotrienes, but again, results have been pretty mixed. And then very rarely, strong immunosuppressants like azathioprine or methotrexate might be considered, but those are generally seen as like a last resort because they have more significant side effects systemically.
Wow. Yeah. So those immunosuppressants, they sound like they're really way down the line if nothing else works.
Exactly. They're usually only considered when all the more targeted options haven't been successful, just because they have a much broader impact on the whole immune system and carry more potential side effects. Cromolyn and montelukast are safer, definitely, but they also tend to be less effective for a lot of people with EOE.
Yeah, it really drives home that there's no single magic bullet, is there?
Yeah.
My own journey definitely showed me that.
You've absolutely hit on a critical point. Treatment has to be highly individualized. It really depends on a bunch of factors.
Like what?
Well, like your specific type of EOE, is it more allergic or more fibrotic, meaning more scarring, or kind of a mix? Your age matters, your other medical history, how you responded or didn't respond to things you've already tried.
Uh-huh.
And then there are the practical things, right? Like cost, what your insurance covers, and honestly, how willing you are to undergo repeat endoscopies for monitoring. That plays a role too.
That's where that whole shared decision-making thing comes in, isn't it? I remember having those talks with my doctor, really weighing, the convenience of one option versus the potential side effects of another, even just the mental energy it took to manage different routines.
That's exactly it. And that's being a strong self-advocate for your own care. It means working closely with your doctor, asking every single question you have, and being totally honest about what's working, what's not, and what actually fits into your real life. Your perspective is absolutely central here.
So, okay, let's say you find something that works. You get into remission. What then? Is it just smooth sailing from there? Or are there maybe hidden challenges people should know about?
That's a really great question, and it touches on a common misunderstanding. EOE is typically a chronic condition. That means it usually needs long-term management.
Right, it doesn't just go away.
Unfortunately, no. For most people, if you start treatment completely, whether it's meds or diet, the inflammation tends to quietly creep back. Usually within about 6 to 12 months, you'd see a relapse. So long-term maintenance is generally essential to keep that inflammation controlled and prevent complications down the road. So maintenance strategies, they often involve continuing the medication, but maybe at the lowest dose, that still keeps things under control.
Lower dose, okay.
Yeah, sometimes that means taking a steroid every other day or a lower dose PPI. And regular monitoring with endoscopies, maybe every 1 or 2 years, is also really key to make sure that remission is holding strong, even if you're feeling perfectly fine symptom-wise.
Yeah, I know some folks who do really well with just a yearly scope and staying on a consistent low-dose steroid. Seem to keep things stable for them.
Absolutely. That's a very common and reasonable long-term plan. And it's important to remember the journey isn't always static, right? Someone might switch between, say, a diet approach and medication, or maybe vice versa as their life changes or new treatments become available. It's all about finding what works best for you over the long haul.
We've covered a lot about the different treatments, but what about the how? The practical side of actually living with these meds day in, day out, making them part of your routine can feel like a whole separate challenge sometimes.
It really can. And with EOE meds, especially the swallowed steroids and often the PPIs too, timing and consistency are just so crucial. But there are definitely ways to make it easier, more manageable.
Yeah.
Simple things like setting reminders on your phone for dosing times, or maybe keeping your medication right next to something you use every day anyway, like your toothbrush, so it just becomes part of that existing morning or evening routine. It's about building those little habits.
Oh, yeah. I've got specific tips that were total game changers for me. Definitely use your phone's alarm. I had one set for my morning PPI way before breakfast and another for my bedtime fluticasone dose. And for the swallowed steroids, I literally put a sticky note on my bathroom mirror that just said, no rinsing. Just a visual cue to wait that full 30 minutes before eating, drinking, or rinsing. Sounds silly, but it worked.
Those little systems, they make such a huge difference in consistency and making sure the meds work right. And something else people sometimes forget is managing meds when traveling.
Oh, yeah. Travel can be tricky.
It can. So always pack your meds in your carry-on bag, never checked luggage. And it can be really helpful to have a printed instruction sheet or even just a quick note from your doctor explaining what the meds are for, especially if you need to deal with airport security or maybe find a pharmacy somewhere unfamiliar. Okay, before we wrap up this deep dive, we thought it would be good to tackle some of the questions we hear all the time from the EOE community.
Yeah, these are the real questions, right? The ones we see popping up on social media and forums during support groups.
Exactly. Things that people are really wondering about day to day.
So these are probably questions that you listening right now have maybe thought about or even asked your doctor. Let's jump in. First one, can I stop treatment once I feel better? Oh man, I swear I asked my doctor this every single time I started feeling good. What's the quick answer? And the really crucial why.
Yes, it's such a common and totally understandable desire. The short answer is almost always no, not without discussing it thoroughly with your doctor first.
Right.
And the crucial why is because EOE is chronic. Even if your symptoms are gone, the underlying inflammation can and often does return silently. Stopping your medication or your diet therapy too soon basically sets you up for a relapse, which usually means going back to square one with treatment.
Yeah, been there. Okay, next question. Will I need to take medication for the rest of my life?
Yeah.
That sounds daunting.
It can sound daunting, yeah. The answer is maybe, but not necessarily always at the same dose or the same intensity. The goal is always to find the lowest effective dose that keeps your EOE in remission for long-term maintenance. So some people absolutely can step down their dose, maybe go to alternate day steroid dosing, or sometimes even successfully transition from medication to a really well-managed diet approach over time, if that works for their particular EOE.
And I guess for some people, newer options like the biologics or maybe even more targeted dietary changes might eventually allow them to taper off the traditional meds too. It really comes back to that individualized plan, doesn't it? Constantly evolving.
Exactly. It's about finding what works for you and your body right now and in the future.
Okay, another one we hear a lot. Are there any truly natural or non-pharmacological treatments that genuinely work for EOE?
That's a really important area for many people, and while the most effective treatments we have for directly controlling the core EOE inflammation are still the medical ones, PPIs, steroids, biologics, we definitely know that certain other things can help support your overall health and maybe complement treatment.
Like what kind of things?
Well, things like stress management techniques can be surprisingly helpful. Avoiding known environmental allergens if you know they trigger your EOE. Working with a dietitian not just on elimination diets, but maybe on supporting overall gut health. These things can absolutely be part of a holistic approach alongside your main medical therapy.
Yeah, I can personally vouch for that. I really worked on mindfulness, slowing down at meals, just being more present, managing stress better, and staying really hydrated definitely helped how I felt day to day. But, I still need my medication to keep the actual inflammation down. They work together, hand in hand.
That's a perfect description. One supports the other.
Okay, one last question for this deep dive.
Yeah.
How do I know if biologics like Dupixent might be the right choice for me?
Right. And as we keep saying, we are going to dive much deeper into biologics in our very next deep dive.
Okay, teaser acknowledged.
But just generally speaking, biologics are usually considered for patients who haven't had enough response from either diet changes or swallowed steroids. Or maybe for people who have multiple allergic conditions going on at the same time as their EOE, like severe asthma or eczema. Or sometimes it's for people who are just looking for a long-term strategy that avoids or minimizes the need for steroids.
Yeah, I actually just recently started on Dupixent myself. It was after trying, well, pretty much everything else and not quite getting the consistent relief I needed. It's still early days for me, but I have to say, I'm already noticing less of that constant tightness, and food seems to go down more consistently. It's a big deal for quality of life.
That's fantastic to hear. And really, the best way to figure out if a biologic is right for you is to have a really thorough conversation with your EOE specialist and probably your allergist, too. You need to review your entire treatment history together, talk honestly about your current symptoms, what your goals are, and definitely look into the practical side, insurance coverage, access, how it's administered. It's a significant step, so it deserves careful consideration.
Absolutely. Well, thanks for tackling those questions, and thanks to everyone who's sent them in or post them online.
Questions really do shape where we go with these deep dives and help keep the conversation relevant and moving forward. We're all learning together in this EOE journey, and your insights are just invaluable. So, before we wrap things up, just a little call to action here. If this deep dive helped you today, maybe sparked an idea or gave you some clarity, please think about sharing it.
Yeah.
Send the link to a friend, maybe a family member dealing with EOE, or even share it with your doctor. Post about it online. Helping others find these resources is huge.
And if you haven't already, please hit that subscribe or follow button wherever you're listening. That way you won't miss our next deep dive, especially the one on biologics.
So we've walked through quite a range of EOE therapies today, haven't we? From, the surprising ways PPIs can work to the very targeted effectiveness of topical steroids, and even touching on options for more complex cases. I think the key takeaway is really clear. You have options.
Yeah, and crucially, those options are grounded in solid science. It might take some time, maybe some trial and error to find exactly what works best for you, but with good support, the right medical plan, and the right strategy, you absolutely can get your life back on track.
And don't forget, our very next deep dive is going to give you that much more detailed look at biologic therapy, focusing especially on Dupixent, which has really been a game changer for so many patients.
Can't wait. So if you found this helpful, please share it. Let others know they're not alone in figuring this out.
This has been The Deep Dive. I'm Sarah.
And I'm Andrei. Stay informed, stay hopeful, and remember, while we explored a lot of paths today, perhaps the most important discovery is the one you make working with your own body and your doctor, navigating your unique EOE journey. Your story is still unfolding.
This deep dive is powered by AI and based on current evidence-based sources, including peer-reviewed journals and expert consensus guidelines. Always consult your healthcare provider for personalized medical advice.